Hi, I'm Tracy Kimball.
And I'm Tom Kimball. Welcome to MS Learn Online with the third installment of our series on medical self-advocacy. Now, hopefully you've taken the opportunity to watch our other programs on getting the most from your healthcare team and palliative care.
In this program, we'll learn about a fabulous resource, disability care centers. Our medical correspondent, Kate Milliken, visits with Rachel Stacom. Rachel tells us about the work she's doing with the Independence Care System, or ICS, in New York City.
It's a long-term care program, community-based program for people who are physically disabled. So we really target people between 21 it's actually 18 now, and 64, and we help people stay in the community and independent at home. And one of our biggest diagnoses is multiple sclerosis.
So how would you define long-term care?
Long-term care is basically when people will require care on an ongoing basis. And it's really interesting, I think, when you have something like multiple sclerosis, which is primarily a progressive disease, and that people will eventually need help in just doing things like, their activities of daily living, which is, getting up and dressed, and also things that really wipe them out, like cleaning their home and shopping. And I think it's really important for people, we've really seen we have a whole range of spectrum, and, I can talk about some people and how it's very different, but it's really important for people to really plan for long-term care.
Because I think when I hear the words long-term care, what I hear is it's the end of the line, see you later, you're going downhill. Your life as your own is beginning to get funneled, and I would imagine that that's not really the case.
No, I think long-term care, I think you're right. Most people think of a nursing home, and that they'll be there, and that's really it. What we see is that when people really get the help that they need, that they become even more independent than what they were, because they were struggling so much to accomplish very simple tasks. That an aide, having a home attendant, can really help you do, and that aid really becomes an extension of yourself, so you can really do things that you want to do.
So give me an example of someone that you might be caring for right now.
I can give you an easy example of someone who really put off getting long-term care, and right now, just to explain, Medicaid is the only insurance really that pays for long-term care. So you have to go through a process of going through this, and people always think of Medicaid as poverty. You have to be poor, when actually there are things that you can do because you have a disability and trust that you can go into to really be able to access these services. So there's one woman who had put off getting Medicaid. She is probably in her late 40s. Really, when we stepped in and brought her into our program, had a lot of fatigue, was really isolated at home because when she couldn't go out. She had a really unsteady gait. And we kept her, once we walked in, brought her in, we got her in for a wheelchair evaluation. She got a scooter, a mobility device. She was falling at home. She's able to get out, and now she's really participating in community programs and going out. And she goes to some of our classes that we have too, like support groups. And
how long is how often is somebody coming in, usually on a standard case, to come help with these patients?
Well, each person is assigned a care manager, which is either a nurse or a social worker, and they're in constant contact. I think that's the most important thing. You really have to get to know someone, and once you do and understand how they, what their life is like, then you really make a difference. I think as healthcare providers, and we always think we know what's best, and really if you don't get the buy-in from the patient, you're going to fail. So we let them really decide what they want to work on, and we help coordinate their services, their medical care, making sure they get good care. We work very closely with the MS centers. And then, we're in constant contact, but at least monthly with them. And then a nurse comes in and assesses them as well and looks for things that we can prevent, especially at in our MS program, we do a bunch of things, but mainly it's looked at preventing complications like bed sores and urinary tract infections, things that people when they accumulate disability are at risk for, and also help with symptom management. I think clinicians are very good at pharmacologically giving medications, but we really look at medications where we can give them aids to help them do kind of time management skills, and so they can continue. I think our goal is to really demedicalize people so they can live their lives and not focus around their condition.
Wow, that's awesome. And I would say that, I have MS, and one of the things that I learned is, MS is such an individual disease. And it sounds like in light of the way that you're dealing with the actual care of MS for these people, your agendas and your programs are also incredibly individual.
Yeah. That's the only way if you don't understand the individual or know what they want, you'll never succeed. I think that's in everything, but especially MS, yes, because the disease affects everyone so differently.
Let's talk about people that don't live in New York. What other organizations can they get involved with or make contact with something like yours?
I think, as a consumer and someone with MS, that you really have to become an advocate for yourself. You have to let people know about the disease. You have to become aware of what the disease is so you can share that. But I think tapping into your local MS society, we work very closely to really outreach to people and get the services that they need. But the clinician is really important too, and they need to know how to help you and what's important to you. So voicing that. Also finding out providers that are used to people with MS, because I think MS, as you said, shows, can present so differently. That's a lot of the healthcare system doesn't really get it. So, having your clinician say, well, who do you use for physical therapy? Who understands the importance of maintenance, and kind of linking with those people, because it's really important that everyone that you deal with understand the disease.
Long-term care, again, has this kind of feeling of, oh, it's at the end of the line. And, as someone who actually is from the other side and organizes it, what tips would you give for people to involve long-term care in their lives?
I would say plan like you're having, like a fire plan in your house. You never want to use it, actually have a fire, but if you have it, then okay, I know, I'll be safe, we'll be okay, we know where to meet. I think of the same thing about long-term care, that, you hope that you'll never need those services and someone to help you, but to know that you can access it is really, if you need it, is really important, because a lot of times people put that off and then they're in such bad situations and really, are at risk then for being in a nursing home because they just can't get the services they need.
And what about the mental element of long-term care for your clients or patients?
Yeah, it's funny. I don't think we don't really present it as long-term care. We just present it really as a community program. So we, it's not something we really focus on. But I think that, we just tell people we're here for you. We're going to keep you home. We're going to keep you where you want to be in the community and out there. And that we always change what we do to adapt to their needs. What
I like about imagining that is it's really kind of a way to empower somebody instead of debilitate them further.
Exactly. I mean, that's what we always, we always focus on what they can do and encourage them to continue doing that.
What is the most rewarding thing for you with your job, Rachel?
That people get to stay home and healthy, and that they can live a life not centered around their disease.
Another great resource as we learn the importance of advocating for our own medical care.
That's right. And it's important to say that sometimes we need to really lobby for resources that aren't always easy to access.
And thanks to Rachel Stacom from the Independence Care System in New York City.
And to you for joining us on MS Learn Online.